Today I'm talking about homeopathic pregnancy and birthing kits. So there's many natural remedies that can be used to help pregnant women to prepare for birth. Just letting you know, it is important to seek advice from qualified professionals, midwives and natural therapists who have been trained in working with pregnant women or have completed further studies related to pregnancy and birth for your own safety. And in general, these measures can normally be used for women that are low risk and that have normal, healthy pregnancies. If you do have a complex pregnancy, it's probably even more important to seek professional advice. So by the third trimester, women are usually safe to start consuming raspberry leaf tea. Sometimes low-risk women may have started earlier. However, always check with your healthcare professionals on individual safety. Perhaps you could consume, but this time 2 to 3 cups a day, made from a loose leaf tea from the 32nd week. It can potentially help strengthen the womb and to help it to prepare for labour and birth. So it's called a traditional PARTUS prep. And also could potentially help with a more comfortable birth and recovery. So some evidence does show that it can help reduce the length of time of the first stage of labour, and it's also quite high in iron, which is a useful nutrient for pregnancy and birth. It's been used for centuries for pregnant women and with low risk of adverse effects. There are no real known effects of its safety in early pregnancy, so always being cautious with whatever you're using in early pregnancy, and also being aware that tinctures of raspberry leaf may contain alcohol, which could be potentially unsafe during pregnancy. It's recommended not to use any alcohol during pregnancy. And by about week 36, the woman could potentially start using homeopathic colophylum. So this remedy also helps prepare the womb and the cervix for the birth, and depending on the potency given at this stage, it may only need to be given, say, once a week. Some women may find that they have a severe lower backache, and a common remedy used for this to consider is sepia, and along with pregnancy massage and bodywork type things. Sepia is particularly indicated if the woman has a bearing down sensation and she's feeling a bit moody and irritable. It's also a common remedy to consider for threatened miscarriage around the later half of pregnancy, accompanied by these bearing down, dragging sensations, and the woman is feeling irritable. Always, of course, seeking medical advice with a history of miscarriage, or if you have any signs of threatened miscarriage, such as bleeding and cramping. However, in general, sepia is a good women's hormonal remedy. It covers lots of ailments of pregnancy and women in general. It is one of the leading remedies for nausea and vomiting of pregnancy when it worsens from the sight of smell and food. And with that characteristic mood. So if around week 37 the baby is lying in a poor position, like a breech or a transverse, some common remedies may assist in correcting this. So to turn the baby into favourable cephalic position, so the head down position, which favours birth. You could consider pulsatilla. Sometimes Natma, Lycopodium and Viscum album also come up. Usually you start with a lower potency. And other options that some women consider to help turn the breech baby include reflexology, moxa on acupuncture points, and also Webster's chiropractic. There's also spinning babies exercises to encourage favourable fetal position, or you can also consider a doctor turning the baby by external cephalic version. Unfortunately, it can be quite painful for the mother. The benefit of homeopathy is that it's not painful, and again, the low risk of adverse effects when used as prescribed appropriately. If the baby does not turn after the homeopathic, there is usually a reason. So this mother might like to search for an obstetrician who would feel comfortable assisting and caring for a woman with normal vaginal birth who has a breech presentation. If by week 38, Braxton's Hicks contractions are not often and strong, you might need to increase the frequency of the colophilum, and possibly later on you might also need to add the herbal extract Mitchella. By week 39, some women start taking in frequent doses of arnica to prepare for any trauma of birth and to help with the recovery. And also arnica is used during pregnancy for any injury, accident, fall. And of course, always seeking advice at any time from the care provider if there is an injury or accident, particularly if it involves the baby having less movements or if any bleeding presents itself. And another thing to consider around week 39, is Mag-Phos. Mag-Phos is another good labour remedy for that cramping, spasming sort of pain. So perhaps alternating the arnica and the Mag-Phos would be something to consider. And if the woman does go in labour, as soon as possible she could start taking in frequent doses of arnica. So this could potentially help the pain, any trauma, any bruising, and help prevent hemorrhage. So the general labour pain and after pains even for some women. If a woman is over term, so they're over week 40 or has a history of this, considering alternating doses of the colophilum and the semisafuga may help to bring on labour and to prevent the woman from requiring a medical induction with synthetic oxytocin. If the cervix is needing to dilate, you can consider using colophilum with pulsatilla, alternating to help the cervix dilate in the first stage of labour. And again, this may prevent medical induction if the woman is not dilating at an appropriate pace, or if the membrane has ruptured prematurely without the cervix dilating, because that can sometimes happen as well. Always seeking advice again for using homeopathy before and during labour, as inappropriate use may sometimes have a reverse effect. So it can cause the uterus to contract strongly, but the cervix does not dilate well enough. Sometimes women do require a lower uterine section, caesarean section, or LUSC as we call it. But we would like to aim to prevent this because it's not ideal. The World Health Organization recommends about 15% cesareans, 10 to 15% cesareans are necessary. However, in Australia, we're over 30% cesarean births in Australia. So this isn't ideal. We want to find ways to decrease this rate of cesarean sections for our health and, of course, the baby's health, the future health of the baby. And in preventing inductions with syntocinon, the artificial oxytocin, or any other interventions could potentially help prevent having a cesarean section. So encouraging hands-off processes, allowing the woman to do the work herself at her own pace and following her own urges, giving the woman support and encouragement but not trying to intervene can be helpful. Also, it's important to encourage your upright positions and active labour, so where the woman moves freely, she can get up and do what she wants and taking what position she wants. Avoid laying on the back wherever possible. So some techniques like calm birth, Lamaze and hypnobirthing can be helpful. So any non-mainstream childbirth education that encourages and empowers a woman to do labour naturally and to empower her to make her own decisions and choices is really good. It's beneficial. So encouraging like a home environment if the woman has to birth in hospital. So trying to avoid all those extra bright lights, not invading her privacy, giving privacy from strangers. Anything that disfavours the body's natural oxytocin should be avoided wherever possible. Aiming to create like comfort and privacy is important. Unfortunately, if things do go unfavourably and medical intervention is medically necessary, there are some homeopathic remedies that could potentially be of benefit in pain management and recovery of procedures. So for example, if there is an episiotomy, the small surgical cut of the vulva, there's homeopathics that can help that. So for example, Staphysagria, taken immediately as soon as possible, is quite useful, and you can follow that with the arnica perhaps 1 or 2 hours after, and you can continue alternating that if there is residual pain or any emotion such as anger after. And routinely, arnica is often used for women to help heal the perineum of any bruising and trauma, and it also helps the emotional shock and emotional trauma as well. If there is a tear or an episiotomy, hypericum can be a useful remedy, a useful homeopathic to use as well. And if the woman has had a vaginal examination and she's responded with anger and indignation, feeling invaded and so forth, Staphysagria is the remedy to use for that. And it's always useful after an emergency cesarean as well. And also Ballus perennis is another one. And arnica, of course. Arnica can help with the pain of the post-operative site. If there is any purulence, like any developing infection of the surgical incision, you can consider Staphysagria and Herbicide. In general, during labours, there's a few remedies that can help that might be necessary, such as gelsemium if the woman is feeling anxious and exhausted. She might even have like a tension headache in the back of the head, in particular if it goes towards the eyes. That's a good remedy for that, if she's feeling exhausted and droopy. Kali carb is a good remedy when there's labour stuck in the back, so perhaps an occipital posterior labour where the baby's facing in an unfavourable position. That can help the woman to continue on and help a little bit with the back pain. Also can be useful for that is sterile water injections. Can be quite painful to inject it at the time of injection, but a lot of women swear by it, like their pain goes away. If there's a lack of progression of the third stage of labour, so the placenta is not coming out quick enough, you can consider sepia. And if there's retention of the placenta, cantharis or sepia are remedies that can help to expel any excess tissue. And then as the baby's born, there's some remedies that can be used for the baby or also for the mother postnatally. So one nice little thing to do for the baby that's not super invasive is rubbing the bush flower essence boab on the crown of the baby's head. So this remedy is specific for helping remove negative emotional and mental family patterns passed on. Help remove any karmic patterns that may hinder the child in life. And this was traditionally used by the Aboriginals. They actually often birthed in the boab flowers. So the baby's being brought into this. So doing this can be like a traditional sort of thing to do, with a bit of ceremony as well, even if you wish. Arnica again might be useful for the baby if there's any bruising, perhaps there was a forceps or a vacuum birth and baby's got a bit of bruising. So that gives a rundown of a few homeopathic remedies that can be used during the birth process, and there's of course more. If you'd like some information on consultations and homeopathic birthing kits, or even professional birth support, please contact me and we can do a consultation. Thank you for listening, and if you would like to see more, please subscribe to my channel. Hope you have a lovely day.